well as interesting so that people will click on it. And then, of course, we have the information, the detailed input that follows. So that is something we have to keep in mind when we are writing any, and especially on nutrition, because there's a lot of misinformation about nutrition out there on social media platforms. Um, then we also, so when we are talking about misinformation, something that we've started doing now, and this is an online segment that we do, is myth versus fact, which is where we actually pick out some information that is gone viral online but may not be completely accurate or may be untrue. We pick that out and then we get experts to talk about it and say, okay, don't follow this advice, follow this advice. Or, I mean, this is untrue and this is what the evidence shows. So we also have that segment so that people can interact with the things that they are routinely seeing on their feed and then get to learn about that topic. That is one way to combat misinformation. I think that would also do much better if we move to a video format, which we are not doing right now, but I think that would be a good move. Um, then, what seems to be working for a lot of health stories, not just nutrition, but whenever we are writing about any topic, is having personal stories. So, it is very pertinent to have a person talk about their experiences, what has worked for them, what has not worked for them. And of course, we have to follow that up with doctors saying, presenting the evidence, because one person's experience might not be true for everybody, but that draws people into the story so that they get to learn more about a particular topic. Then, of course, there is the challenge of putting across uh, precise and clear information. And for that, again, I turn to experts usually to tell us, okay, what are the best studies that have come out in a particular topic. Of course, over the years, I have been reading scientific journals, so I can tell, okay, this is something that we can trust, this is something we cannot trust. But even there, it helps to have experts come in and say, okay, these are the three most important RCTs that have been done in a particular area, and then we can pick that information and make graphics and charts about it, because that makes it easy to understand. Uh, that is also something we've been doing for our stories. Uh, but what is also important from the side of media, I think, is to push for policy reforms. Uh, One of the things that we actually recently did was a story on front of pack labeling. So it has been around 4 years. I think 2022 was when the first draft notification came in from the FSSAI. But we still haven't got a decisive answer on what form of FOPL we can actually implement. And the hope is always that when we talk about these issues, the government gets more involved and takes a decision or gets in a policy guideline. Same with trans fats. We've been writing about that. We have to work on reducing trans fat content in our foods. Another great initiative, of course, which was taken by the government, was forming the sugar boards in schools, which also led to a host of stories where, one school learned from the other school on what can be done, what is being done. And that also plugs into what we are writing about, because when we write about uh, something, children can learn about what is good food, what is bad food, but that's immaterial if there is no healthy option available to them. So that is important, that whatever we are writing about, that children are able to experience that in their environment, so that when they are going to their shop or when they are going to their school canteen, they are able to not have that packet of chips and go for a maybe sprouts or whatever, a healthier snack. That is very important to have that in the real world. And again, there, the constant reporting, I'm sure, helps to change these things at a school level, at least at the moment, if not at a larger policy level. Um, and I think that's it. I had another point. I just it skipped my mind, but I think that's it from me. If there are any questions, I would address them.
Thank you so much for bringing up those points. The short video formats is one thing definitely that we should also work towards. As a consortium, we are working towards it, and then we are active on social media. We are trying to explore digital platforms. Yes, it's not just us, but I think as one of the researchers from Canada sometime back said, to combat misinformation, even the trained nutritionists and professionals have to be very active on producing digital content to counter misinformation. They need to, instead of just countering in chat boxes and things like that, create more and more content that is based on authentic science. That's one takeaway I have from your uh, you know talk. And also thank you for bringing up another issue which says, yes, the media can talk about it, yes, we can promote right kind of authentic information, but it's all about making the choices available for kids. That's the creation of enabling environment, which also has several drivers at individual level, at the school level, at the policy level, and from the community. I think we have to work at various levels. I think uh, I don't know. I mean, it would be great. I will also discuss this with many of our all of our LFO partners, but it will be excellent if some of the media houses can join this initiative for amplification of the messages. So with media
Definitely.
houses taking it up and amplifying for the cause, I'm sure we can move mountains. It's very easy. So I think you can take this message to your media house from us. We are also trying to work a bit closely with Times very soon with Bennett. So let's see if we can break some ice with the media houses. Thank you very much for being part of this very important discussion. And then I see some questions. uh, I think most of them are answered. There is a lot of enthusiasm to join the consortium, how we can be part of this initiative. Everyone is welcome to be part of this initiative. Amplify our messaging on digital platforms. Get in touch with us if you think you are a powerful organization that has a voice. Probably we can join hands. Thank you very, very much, Ms. Anona, for your time.
Thank you.
Now we will move to our next speaker, who's risen rapidly in the last 2 years in the area of nutrition research. She has been our MSc student some time back, but she's been instrumental in working with our team in developing India's first nutrition food literacy tool. She represents the entire team that has worked with her, but she's spearheaded as a student and then published this work recently on behalf of LFOF. Archana, can you introduce your colleague and our student, Miss Simran Yadav?
Yeah, good morning, everyone. We are pleased to introduce Ms. Simran Yadav, a gold medalist and a proud alumna from ICMR National Institute of Nutrition. She pursued her BSc in Home Science from Lady Irving College, University of Delhi. She is a clinical nutritionist, gut health specialist with expertise in integrated care for irritable bowel syndrome, microbiome science, and nutrition program design. She has developed and validated Infolit, the India's first nutrition and food literacy assessment tool for adolescents. Her work bridges clinical practice, research, and public health nutrition with a strong focus on evidence based and person centered care. Simran, we are pleased to welcome you and we look forward to learn more about Infolit tool. Thank you.
Thank you so much, Dr. Archana and Dr. Subbarao. I think it's always a delight to come back to your alma mater and being introduced by your guides. Thank you so much to New Life team and LFF to invite me on this panel to speak among some of the brilliant speakers that we have today on the panel itself. I'll present my screen. Please confirm if you're able to see it.
Yes, slideshow mode, please.
Yes, sir. I hope
Yeah,
it's fine now, sir.
working
Yes,
good. Yeah.
awesome. So, hi everyone. Good morning. I am Simran, and today I'll be briefly talking about the tool called as Infolit. It is India's first tool to assess nutrition and food literacy in Indian adolescents, and it was developed at ICMR and we were able to publish this work last year in 2025 in Frontiers in Nutrition, and yes. So why adolescent? I think this is a question that keeps coming time and again. Why adolescent nutrition has been, or why adolescent nutrition literacy tool has been picked up? The number one reason for it is adolescent forms one of the largest population across the globe from the India itself, and as Dr. Allison has also highlighted that how schools form an important platform for disseminating nutrition and health information, that underscores that how schools are the prime setting to build upon nutrition and food literacy. Yet in India, the nutrition education is neither integrated nor prioritized in Indian school curriculum yet. According to recent survey of CNNS, it has also highlighted that how our adolescent population is also prone to NCD risk as well. Almost 5% of adolescents today are overweight, approximately 10% of them are pre-diabetic. As we all understand here that Indian adolescent youths face a paradox of triple burden of nutrition, rising obesity, persistent micronutrient deficiencies. Along with all of this, the aggressive food system that our adolescent is exposed to is something that we have to look out for. Ms. Sanona has also in detail talked about how media literacy is also crucial. And time and now again, many research papers have indicated that aggressive HFSS marketing has led to a surge in consumption of these ultra processed foods. So it becomes extremely crucial to understand how literate, how critically our adolescent of India today are evaluating label literacy. As per a research survey, it has been indicated that only 1 in 3 adolescents actually read food label and able to interpret them clearly. Now, what is nutrition literacy and food literacy? I think Dr. Preetu Mishra has also highlighted that nutrition literacy has been more on the knowing aspect of it, where it is focused on capacity to obtain, process, and understand nutrition information. Whereas when we talk about food literacy aspect, it is focused more on the doing aspect of it to include skills and confidence. Now, we also have a NUTB model of health literacy, which has been broken down into 3 different segments. One is functional literacy, which focuses on the ability to access, understand, and use basic nutrition information. Whereas when we talk about interactive nutrition literacy, it is focused on the ability to exchange knowledge, engage with food environment, and self-regulate the nutrition information among your peer circle. Whereas when I talk about the critical literacy, it is the ability to critically evaluate food claims, marketing, labels, make autonomous choices, no matter even if your favorite celebrity is endorsing about a particular food product out there. Now, why specifically are we building on the a tool which is grounded in Indian demographic and is culturally relevant? I think Dr. Allison has also talked about how NEET S has been adapted to different countries, to different demographic. That also places a special importance that why a tool needs to be geographically and culturally adaptable. So far, globally, we do not have any universally accepted tool for nutrition and food literacy. Many countries have developed their own tool. For example, when we talk about Iran, they have FNLIT, but which talks more about Iranian dietary context, has a lot of conversation around uh, processed food meat consumption. Whereas when I talk about the USA food label literacy tool, it has US traffic light signal conversation, which is not so relevant when we talk in the Indian dietary context. So far, as per our knowledge, there hasn't been any existing validated tool to address the Indian dietary context, the HFSS aggressive marketing, the traditional Indian foods such as millets, or FSI labeling, or to address the triple burden of malnutrition. As I've earlier talked about, India needs an own validated tool due to the cultural mismatch. The existing tool focuses on other dietary aspects which are not so relevant to an Indian context. The scale of the problem is pretty big here. Only 1 in 3 adolescents are reading food label. Aggressive food marketing normalizes the junk food in the Indian subcontinent. So it becomes really important to understand how well adolescent of today's India is able to interpret and understand this carefully. There's clearly no standardized baseline tool to address nutrition and food literacy in India. We cannot design intervention without knowing the baseline information and thus to evaluate the impact of school nutrition program. Now, what is the conceptual framework of Infolit? Infolit has been designed on 2 domains, 4 dimension, and 11 components. The 2 domains that we cover here are the cognitive domain, which talks about the knowing aspect or the nutrition literacy aspect of it, in which we have covered 4 dimensions: nutrition knowledge, lifestyle, food safety, and food preparation. Whereas when I talk about the skill domain, in this we have covered 3 particular dimension based on the Nutbeam model of health literacy, which is functional literacy, which talks about the ability to obtain and apply nutrition information. When I talk about interactive nutrition literacy, it talks about the ability to interact and regulate your emotional needs as well. Whereas when I talk about critical food literacy, it talks about the ability to deconstruct marketing claims, food label literacy to read and interpret labels, and critical decision making to choose despite promotions and make an autonomous choice when it comes to purchasing food products outside. Now, Infolit has been rigorously built on a 5 phase journey. The qualitative framework has guided the quantitative stages for development of Infolit. So the first phase has been focused on item development and literature review, on which we were able to look at 150 items, which was ultimately tapered down to 98 items. The framework consisted at that time of 2 domains, 4 dimension, 11 components. After which we did a phase 2 of content validity to understand whether these items are validated for the peer group. And we also did a content validity with a 5 panel expert from different fields such as sociology, anthropology, medicine, nutrition, and dietetics. After which we also did cognitive interviews with almost 15 adolescents to reframe and understand each of these items. After reforming all of these items, we were able to do construct validity with almost 400 adolescents, after which we did a psychometric analysis of all of these items: item difficulty, item discrimination, and Cronbach alpha. Factor analysis was also done to understand underlying correlation with different factors and the constructs of the tool. Phase 4 was largely focused on test retest reliability to understand whether the item were resulting in same set of scores after a 15 days of gap or not. We did a bland at Altman plot, and we were able to understand there was a negligible mean bias, and it indicated a very good reliability. The phase 5, we were able to arrive at a cutoff score where low where a score of less than 40 would indicate significant gaps in nutrition knowledge. The priority target would be for intensive intervention in particular stage, whereas someone scoring a score of 41 to 55 indicate medium level of literacy, a basic knowledge presented, whereas a score of high means more than or equal to 56. All of this is out of 73. We have 73 items listed in the tool. Some of the sample questions that I would like to highlight on the panel today that were Indian specific and different from other tools that have been made in Western nation is that it talks about iron deficiency and anemia related questions, reading about Indian packaged food label, resisting marketing for HFSS by decorated celebrities of India. and also talks about balanced thali focusing on local food groups and seasonal produce. What makes Infolit unique? I think it's the tool that integrates nutrition literacy and food literacy for Indian adolescent. If we look at other tools globally, some of them talk about nutrition literacy or just food literacy. There are very few tools which talks about this integrated concept. It has been grounded in NUTB model and Indian dietary reality. It's culturally validated with cognitive interviews, proper validation and reliability, and clear cut-off scores have been demarcated for program monitoring. Uh, what are some of the applications when we talk about Infolet? How can it move from measurement to an impact side? Number one is definitely the school health programs. A baseline screening of adolescent is something really, really crucial. Now that we have NEET S also running by the UNICEF in the back end, Infolet can also help us understand the individual literacy aspect of it. Identifying gaps by school, grade, gender would help us to design targeted and age appropriate nutrition curriculum. Portion Abhiyan integration, add probably we can add NFL into the portion tracker metrics, assess literacy alongside wash and diet diversity indicators. Curriculum reform is something ICMR and IN has been working on a very long-term basis, especially I think Dr. Subbarao sir has been working on this to integrate with NCRT state textbooks as well. Intervention design and evaluation to assess pre and post measurement in school nutrition program, policy and research to assess population level of NFL surveillance across different stage. And I think Ms. Anuna has talked in detail how digitalization is the way forward. So digital adaptation is something we can look forward to converting it to mobile or a tablet based platform to scale across India and different states itself. Yes, that's about the scalability and the road ahead. I think we now need to scale it on a larger level and do few regional adaptations as the food habits differ from north, south, and east and west India. We'll be also looking at the stratification from urban India compared to the rural India masses itself, and looking at the impact or the policy evidence base of NFL tool, Infolit tool itself. The key takeaways from I think the today's presentation or from the today panel would be that adolescence offers a second best window opportunity to look at the or improving the nutrition and food literacy when we talk for today's age group. There is no existing global tool that is appropriate for the Indian context, so Infolit clearly fills that validated gap. Infolit measures what matters, both the nutrition literacy and the food literacy aspect of it, and in detail talks about functional literacy, interactive, and critical literacy together. The tool is deployment ready. It can be utilized for different schools, for different policies, research, and at a digital scale. It's important to understand that without measurement, we cannot assess what is the progress that different policy and program that is making. So it's really, really important that we measure, we quantify the qualitative aspect, the qualitative changes that are coming through different policy changes. Thank you. I think that's it from my side. Any questions I would be
Thank
delighted to address.
Yeah, thank you very much, Simran. Very nice presentation, very detailed. We have several questions. Actually, there are two questions. One I answered, but you can still give your take on that. Somebody said, can this tool be used for other age groups, especially younger children? That's one question. The other one is, if adult women are the study population, can the nutritional literacy scale for rural women be termed as NLSRW, and be use can we use this tool in for the others as well? I think the question is both, more or less, both the questions are same. Somebody wants to use it for younger age group, somebody wants to use it for older women. So, what is your take on this? Otherwise, I mean, after this, I'll also probably pitch in with
Yes.
a few points if needed. Please go ahead.
Yes. So, as per the data from different countries and research globally, it has been found that a tool which tries to assess nutrition and food literacy should be age specific. And when we talk about for a younger age group, the ability, the purchasing power, the cognition, the aptitude also differs largely. So the set of items being addressed also changes. So I would say currently Infolit is able to capture the nutrition and food literacy aspect from the adolescents. For preschool or for early age group or for adult, you need a separate set of uh, tool to assess these aspects, because largely the change in cognition, the purchasing power, and the change in aptitude itself.
Thank you. I think the basic outline is that it needs to be custom made. No copy paste approach can work. Uh, this can form the basis, but definitely yes, we can quickly run a few more aspects into it, and then what are suitable for the age group and the context that we're working on. It can be useful. There is another question from Madhura Das. She says, Infolit is based on cognitive and skill domains. Should an effective domain that is related to adolescents' behaviors and influence not only the knowledge but also the mood and peer influence? Can it be part of this or not? For this question, as Simran has already said, we've already introduced the domains related to media literacy and then how they understand advertisements and marketing. But Simran, over to you to answer the mood part of it and also the influence on
Yes.
body image part of
Yes.
it quickly.
Thank you so much, Madhura. I think it's an excellent question, and we already have few items focusing on mood, peer influence, and body image as well in the infolit itself. So the interactive literacy is which covers the mood, peer influence, and the body image part of it, to understand and interact with your peer circle and understand about what food choices to make. And interestingly, we also have, just to give an example, in the infolit we have one item which focuses on, will you be giving up on certain food items if an influencer is talking about you lose 5 kg or 10 kg of weight within a week's time. So yes, Madhura, so it interactive literacy of infolit talks about the mood, peer influence, and body image aspect of it.
Thank you. I think there'll be many more questions. We'll also have to check on YouTube what's happening. Nevertheless, we'll park some of the questions for later. Thank you very much, Simran, for that quick presentation. Now we move on to the next speaker. We got Dr. Neha Rathi from Bakchi School of Public Health, Ahmedabad University. We've had some interaction with Dr. Neha and then also looked at her work, which used qualitative aspects to understand and generate evidence on the role of schools in deployment of food literacy for adolescents. Studies based on qualitative work have contributed quite well for the literature. But before she starts a presentation, I would like my colleague Dr. Archana to quickly introduce her. Archana, over to you.
Yes, we are privileged to introduce Dr. Neha Rathi, visiting professor from Bakchi School of Public Health, Ahmedabad University. She pursued her PhD in Health Sciences with specialization in Behavioral Nutrition from Deakin University and MSc Home Science from SNDT Women's University, Mumbai. Her work focuses on food environment, especially in schools and homes, using qualitative research approaches. Dr. Rathi is an expert in the field of health behavior with strong focus on understanding the facilitators and barriers to food intake, identifying barriers and enablers of physical activity, and advancing nutrition education. Her research contributes valuable insights into how food environments and behaviors interact to shape nutrition and health outcomes. Dr. Neha Rathi, we are pleased to have you with us today and we look forward to your insights. Thank you.
By the way, to all the attendees, Neha Rathi is not in Ahmedabad. She's sitting across my room in our institute. She's coming up for another meeting. So she's in Hyderabad, by the way. Okay, right. Neha, over to you.
Yes, thank you, Dr. Subarrao, for the warm invite. And yes, definitely, I am in the city of pearls, Hyderabad, and of course, absolutely at NIN. Uh, first, before I start, because I have many slides, but of course, I'm not going to go through each one of my slides. So, my research, as already mentioned, by Dr. Subarrao as well as Archana, I actually, kind of showcase the views of adolescents, other stakeholders like parents, including both fathers and mothers, teachers, school principals. So today, I will be talking about two of my research papers. I'm just going to put in my slide on the slideshow. You can confirm if you could see it. 1 second, I'll just start with it here. Yeah. Can you see me and my slide, both in the slideshow mode? Is it not 1 second? Again, I have to maybe 1 second. Yeah. I'm doing it in slideshow. Let me have a look at it. Yes. Is it now okay?
Yes.
Yes. Okay. So, as you know, my title today suggests, it's role of schools in the development, food and nutrition literacy in adolescence. I will be sharing evidence both from urban and rural India. And, our adolescent, sitting here at one of the, the dialogue, she would perhaps echo some of the views what the other adolescents in rural Varanasi have mentioned. So today I'll be focusing on these two articles. The first one, it's a qualitative inquiry based in rural Varanasi, published in 2022. So, Simran has already covered a bit of it. So just look at, how food consumption patterns have changed, and have gone through substantial changes. Again, prominent dietary changes includes, increased consumption of ultra-processed packaged food, and definitely there has been a reduced intake of home-cooked food. So where the skill aspect comes, how many of us know cooking, and is cooking an important part of our Indian school curriculum? We can talk about it later on. Definitely an increase in overweight and chronic degenerative diseases. Adolescent obesity poses a severe public health challenge, just not in urban India, it's catching up in rural India too. And food labeling, important, is viewed as a potential mechanism to improve people's diets at the population level to tackle escalating obesity rates and associated NCDs. Food labels, powerful tools of nutrition communication to empower consumers to make nutritious food choices. Previous literature highlights it as one of the cost-effective interventions. And in India, the Food Safety and Standards Authority of India has made it compulsory on all packaged food products. But letting you know, in rural India, still some packaged food is sold. And, in transparent packets, we actually have no labeling. So as such, there's no monitoring or regulation happening with regards to those kind of products. And yes, there has been a paucity of data on the use of food labels in the Indian context. Moreover, the data is primarily restricted to urban settings. So the study aim was to explore rural Indians' perceptions about packaged food and food labels. I used a qualitative research design, as I mentioned. Any qualitative research has to be underpinned by a theory. I use the sociological theory of social constructivism, which actually means, where this participants or your respondents have to share their lived experiences, what they, feel or they perceive, that's captured. This was conducted in a Tikri village, which is in, Varanasi district. Adolescents aged 10 to 19 years were interviewed. They were recruited using convenience as well as snowball sampling techniques. And as part of qualitative research, semi-structured face-to-face interviews were conducted between December 2021 February 2022. These are some of the questions. First we start, like an rapport building question. You talk about their daily diet. And then we, of course, moved on to different questions about food label, like what do you read in the food label first? And then, of course, we asked for some feedback regarding it. Now, there's some concept called the data saturation in qualitative research. That means, it's the point where no new themes or interviews emerge. So here it was the 39th interview, but we still conducted 5 more interviews to confirm the saturation point. All the interviews audio recorded, duration 14 minutes to 26 minutes. We gave fresh seasonal fruits for their contribution to the study. So that time, I think it was winter time, and the Allahabad guavas, very famous, again, rich in vitamin C. So we distributed that. This was approved by the Banaras Hindu University Medical Ethics Committee. The interviews were conducted and conducted in Hindi, and then we translated to English. NVivo software was used for for coding the data. We use template analysis technique, which involves both deductive and inductive coding. If we have time, I'm happy to discuss about this also later on. So this was the sample, as I said, 29 boys, 15 girls. 36 were in school, 7 were school leavers. One was attending a degree college. He was a 19-year-old boy. Now, what were the main themes? Popularity of packaged food, factors triggering consumption of packaged food, reading food labels was not a regular practice, important, limited knowledge about food labels and repercussions of consuming packaged food, challenges in understanding food labels. Food label is not a part of the school curriculum, which many of us would agree here, and suggestions definitely for improvement in food labels. Now, reading food label is not a regular practice. Quite a few adolescents reported that did not bother to read the food label. So here, I would like to share some of the quotes here. Till now, I'm not used to it, that is reading the food label. But if you insist, that means they're telling me that if I insist, that adolescent is going to read it from now. So they are not even aware that there's a need to read the food label. So that's very important to note here. Then another one said, but rural people don't see it. Only city people will read package. So this is the perception there. Again, limited knowledge about food labels, of course, that's quite understandable, because if they don't read, how they are going to have knowledge about it. And what is the limited knowledge? I see if date is expired or not. If date is expired, then the product is not useful. It affects our health, causes stomachache, but I don't know much about it. I just see for the date, nothing else. And I think many of us in the panel, I'm not sure how many of us actually read every item of the food label. So, we should question ourselves, about this even. Many of us maybe just look at just the expiry. Okay, if it's not expired, fine. Some of us may look at the price. It depends. How many of us look at the nutrient, labeling? I really going to doubt. And moreover, if we read, do we understand that, comprehend that? I see for cost and pay at the exact amount. Otherwise, the shopkeeper can demand more money, because the adolescent generally tend to have limited pocket money. So perhaps that's that's the reason he or she would have mentioned. Challenges in understanding food labels. Barring 4 male adolescents, none of the other study respondents were able to comprehend the nutrient information displayed on the food labels. So let's see what are the challenges. The one in Hindi I can read, the rest I cannot read because it's in English. I never see any symbols. I don't read the ingredients. I don't read all these things. I don't understand. It is hard to understand. We have this green dot for the vegetarian thing and the red dot for the non-vegetarian. When I asked them about the dots, so these are the symbols I talked about, they were unable to tell me, like none of the participants could tell anything about it. Food label is not a part of the school curriculum. Already, our students are burdened. Now, how do we burden with food label literacy? Unanimously, the adolescents reported that the schools do not impart any knowledge about food labels. I'm sure one of the school principals here will be speaking. She would be able to echo what I'm trying to say. It's not possible to include everything. So, what is the other strategy? Do we do some extracurricular activities? We have to look into it. The teacher did not teach even in school. The teacher teaches from books, but does not discuss all this. And one of them said was not taught about this, about food labels at school. Suggestions for improvement. First, some of them suggested the content of food label should be written in Hindi, as it will facilitate better understanding of the food label. But I don't think this is doable, because other states where Hindi is not a dominant language, it's other language, it's the native language. Maybe this thing would not work, but there could be some other possibilities. We could explore that. So yeah, children should be taught about this in school. All children should know about it, because it is a basic thing. The government should do something for this. Hindi on one side and English should be given on the other side. So this is, another recommendation. Pollution is increasing because of plastic. So most of our wrappers maybe sometimes are in plastic, they say. And moreover, in rural, settings in Uttar Pradesh, where, the study was conducted, as I mentioned, transparent brackets, they sell the chips and all. We should ban plastic bags. We can use paper bags for packaging. Some quick discussion points, uh, practice of reading food labels, again, not a regular basis while purchasing or consuming. It was not prevalent among our interviews. And it's just not in Indians, even in developed nations like America, many of the adolescents don't read them. Again, echoing the views of Sri Lankan and urban adolescent study participants reported reading the expiry date and brand name. So the Indian subcontinent, almost similar findings. One of the biggest challenges faced by our adolescents about the food label information was written in English, and therefore they could not kind of comprehend the information. Possible solution maybe both Hindi and English, but again there are concerns with regarding for other states. Another challenge was the nutrient information in food labels was too complex to understand, a finding well documented in the literature. This difficulty could be attributed to lack of skills-based nutrition education delivered in Indian classrooms. Regrettably, Indian schools do not prioritize food and nutrition education. Nutrition and food literacy is essential to make informed food choices, and therefore, Indian schools should consider revising and upgrading the existing food and nutrition curriculum. And I think Dr. Subara is working already on it. Now, this is the other one, it talks about this is actually, an old study, 2017, if I look back now, almost 8 years or more than that. This was based on my PhD work, where I have actually interviewed 4 different stakeholders. There have been many studies where we have just focused maybe on adolescents or maybe just on teachers, just on mothers. But this research actually captured views of, the key, stakeholders. Of course, we did not look at the policymakers, but definitely at the, consumer level, mainly we have the adolescents, teachers, principals, as well as parents. And we look at their views also in the subsequent slides. Curriculum framework of Indian schools does not prioritize health and nutrition education. Definitely the Planning Commission in 2008 showed that, but it's now 20 years old, this reference. But even if you look at now, most of the books, and even Simran's, one of Simran's, I think, starting slides mention that it does not have any priority given. Why? What was the reason? Strong emphasis on physical sciences with prime focus on laws and theories, hence limiting the scopus for discussion on nutrition topics. I think Dr. Subara had published on the books, what is the coverage of nutrition content. I recently did one study on anemia and anemia content in science as well as home science books. Hardly. And then we talk about anemia Mukt Bharat. So you need to put it in the books even. Curriculum lacks the ability to provide adolescents with essential life skills such as food-related skills. Again, skill-based education is important. Why? Because it just not gives declarative knowledge, it also gives procedural knowledge. And to, inform behavior, declarative knowledge will not be able to do it all by itself. You need both declarative and procedural. Procedural is how you do it. Therefore, it may be important to modify the curriculum to include more practical nutrition and health education for the betterment of adolescents' present and future health. As I said, these are the key stakeholders we looked at. Therefore, the study aim was to examine the views of major stakeholders in the education process so that they may be incorporated into the design of future school-based food and nutrition education curricula. Again, it was a qualitative research using the same theory, social constructivism. This study was made in 10 private schools in Kolkata, India. Adolescents studying in grade 9, and then convenience as well as snowball sampling techniques used. Similarly, semi-structured face-to-face interviews were conducted February 2015 and August 2015. Long list of questions because since the stakeholder group changed, so that's why that answered what Simran said, you have to change your tool. So here also we had to change tools for the different age groups. So this answers it, different tools for different kind of stakeholders. Interviews were conducted until saturation and audio recorded. One interview was not audio recorded, as school principal refused to be recorded. Therefore, only field notes were taken. And that is perfectly fine in qualitative research. Duration between 9 and 65 minutes. Generally, adolescents gave shorter interviews, and few principals even. No reimbursements of expenses or incentives were given to interviews for their participation in the study. Ethical consent was provided by Deakin University's Health Ethics Advisory Group, transcribed verbatim. All the interviews were conducted in English, so no translation was required here. And we were quantitative analysis software, the analysis software was used to, to code the data. I again used the template analysis technique by Nigel King for deductive as well as inductive coding. Results, we have 15 adolescents, 5 boys, 10 girls, 15 parents, 1 father, 14 mothers, 12 teachers, all were female, 10 principals, 1 male, 9 females. The themes, curriculum should teach the importance of healthy eating. I think it is doing it, but still, there were parents who said it's not teaching that. Food and nutrition curriculum, food and nutrition are currently taught as part of biology and home science curricula. I think most of us will agree with that here again. I think in CBSE it's known as the science, but in ICSE it's biology starts at 9 and 10. But I think in CBSE it's till class 10, it has to be at this part of the entire science syllabus. Curriculum is too focused on imparting theory-based knowledge. Curriculum is outdated and limited. Curriculum involves too much rote learning. It's undermined by the school filled environment. I agree. You're at one on one hand you're teaching in in the book, you're conveying a message, eat healthy, and then the same school canteen is supplying samosa, pizza and burgers, soft drinks, because that time the 2020 FSSAI canteen guidelines were not yet published when this study was conducted. And I still doubt how many schools are even following that. Because are we doing the audit? Is the FSSAI doing the audit? Again, that's under question. Food skills are necessary for human survival. Very simple. I talk about the cooking skills. I went abroad. Let's say if I did not know, how will I survive? So that's actually important for independent living, as well as it helps in healthy living also. So it serves dual purposes, actually. And of course, third is economic. Abroad, it's not easy to afford, food. So, if and definitely home cooked food is kind of cheap as compared to, purchasing food from outside. Time constraints and lack of interest limit the practicing of food skills. Role taught as part of biology and home science curriculum. One of the quotes, let us look here. Let me see what the principle says. In order to survive, food is important. Therefore, all school, I mean, not just girls' schools should teach food and nutrition, but I think even boys' schools need to educate about food and nutrition. There's a teacher for. Let's look what she has to say. You know that boys' school generally don't offer home science to their students. So how do the boys learn to cook? That time, I think only in Calcutta there was one school, if I remember, it was DPS. I think DPS Newtown, which was offering home science to both boys and girls. Otherwise, no schools. Even Simran can say she's studying in Lady Irwin College. She has studied there. Are boys allowed to study? I don't know. I will doubt that. Simran can answer that later on. Curriculum is too focused on imparting theory-based knowledge. I think the curriculum is more or less theoretical. If some practicalities there, if it have been good. There are complicated names associated with digestion, associated with enzymes, so at times it's complicated. They are taught from the book and there is no practical application of knowledge. Curriculum outdated and limited. I feel the curriculum is outdated. Food faddism and food allergies are not covered in the curriculum. That time, I think particularly when I look at, private schools, people talk about peanut allergy and all. So they wanted to be aware of it. Maybe this will not be an important concern in rural schools, I think, or maybe public schools as such. What I dislike is that, like, ever since class 6, we have been learning the same thing over and over again. Yes, I do agree sometimes the curriculum is repetitive. I've been a school teacher, of course, from 2010 to 2013. So I know books really just don't get updated. And perhaps the NEP also, I don't know, when was the last one? Maybe 1980s, and then it came in 2020. So this also answers it. Curriculum involves too much rote learning. To be very honest, children get bored because it's more of mugging up, memorizing without critical comprehension of the lessons. You have to mug up a lot of things in the food and nutrition chapter, so I would like that to be a little more understanding. Curriculum is undermined by the school food environment. It's not that great because it's taught that we're supposed to have junk food, we should have nutritious food, but junk food is actually served in our canteen. So I personally don't like it. It's a contradictory message. We tell them that junk food is not good for eating and this is not good for your health, but at the same time, we are selling all the junk stuff in the canteen. I hope the NIN canteen is selling all the healthy stuff. I don't know, but perhaps I'm going to explore that. Role of school in food skills training. The curriculum does not support the building of food skills, but we do have cookery clubs once a week, and kids who are interested in cooking participate in club activities. So it's not like schools are really not doing anything. They are, making an effort in skill development. But of course, it's as part of the extracurricular activities, and it's not a mandatory thing. So there are some schools, like some countries like Ireland and all, where they have made home economics compulsory till class 6 or till class 8. So at least you learn the basics. They teach them how to read a food label, how to make purchases, like what is a fresh, fresh and stale, and of course, kind of basic cooking skills. We just don't have any strategy to inculcate food skill. It's just the cooking club which supports that. It will be good that if it's included as part of the curriculum in future. Being a member of a cookery club, I get to try new things every Friday. So even adolescents are excited, right? And moreover, cooking has therapeutic benefits. We can talk about it maybe in some other discussion. Indian schools try to provide food skill training through curricular activities. So it's not always negative. We do have some positive things coming up. However, these co-curricular activities have their own limitations, which I just mentioned. Considering these limitations, Indian schools need to rethink over these co-curricular activities and design suitable skill-focused healthy eating programs to sustain the healthy and scholarly needs of their pupils. Uh, I've seen some of the school nutrition gardens coming up in rural India, in one of the public schools, two or three public schools when I was in Varanasi. So that was a good thing. And they were using those, whatever the kitchen garden produced, and the students were involved in it. And the similar food was used by the midday meal cooks for the preparation of midday meal. So some schools are definitely doing some good work. Perhaps the introduction of food and nutrition literacy education program in secondary schools could be viewed as a viable strategy to inculcate food-related life skills in adolescents. A number of researchers from different
Okay.
national contexts have proposed food literacy programs are effective, definitely, in modifying, food behaviors, including increased consumption of fruits and vegetables and healthier food choices. School canteens require modifications to increase, and as Dr. Allison also would agree with this, to increase the availability of healthy foods while, uh, reducing the availability of unhealthy foods. For a taste change, one day it could be good, maybe Saturday could be a cheat day. I'm just saying that could be. Such environmental changes would complement the teaching curriculum, which in turn will foster healthy eating among students. In all these developments, the involvement of all the stakeholders in the school operation is essential, as it supports successful implementation of a skill-based food and nutrition education program. One of the limitations, which just comes to me, one from
Neha,
the questions raised by the audience.
Neha, you have one
We
minute to wrap up, please. Yeah.
Yes, it's my last slide. I know I'll be stopping. Just from the question which was posed to Dr. Allison, vendor. So one of the limitations, we did not interview the vendors here. If I could have done that, that would have also added, kind of further strengthened my findings. And yes, and thank you. I know I've taken a lot of your time, but yes, yeah.
Okay. There are two quick questions. I think I have answered one of them, but you can still add to it. Dr. Naini was asking, do you have traffic light labeling for sugar, salt, and fat content in India? Was this research based on detailed nutrition labeling or both? That's the first question. I think I said it that there is no FO panel in India again. This was based on the mandatory nutrition information that is to be declared. I hope I'm right on that. You can add to that.
Absolutely. That.
Yeah. And there is a second question which says, uh, what was the rationale that the government school principals are not included in the second study?
Oh, okay, okay. Yes. No, so the focus was why on private schools? The reason being overweight and obesity, that has been already been researched, was more prominent in private school children as compared to public schools. So that entire study was conducted in private schools. Yes, it would be good to repeat that in public schools. I think recently somebody has published in Frontiers itself, but that is on the primary school food environment, like for the primary school food children. Yes. So yeah, I'm happy to repeat it if I get funding from the government of India. Not a problem.
Thank you very much. I think we're running short of time, so we'll move to the most important part of our, the e-dialogue. That's the panel discussion, because the panel discussions usually bring in very different perspectives from varied fields, and then they also add a very, very important takeaways for us. So in this panel, we have uh, five speakers, and I request my colleagues Sushmita and Kriti to introduce all five of them so that the panel can run smoothly without breaks. The first speaker is Miss Darshana Sutar. She is officer in charge Girls Education Government of Gujarat. Thank you, Miss Darshana, for staying with us for a very long time. I see that the YouTube is flooded with all teachers from Gujarat. Many of them have joined. Thank you for bringing them in, and there are also several others on YouTube. And one we have Dr. Nayani Dharmakirti from Sri Lanka UNICEF, and she is the one who's who was instrumental in implementing the neatest tools to assess the food environments in Sri Lanka. She has very, very good lessons to offer us. So we'll just find out what's found from there and how it has been used. Dr. Tina has been an important part of our Let's Fix Our Food initiative, but she's also the one who's spearheaded administration of neatest tool in Delhi schools. She has some points to add. Then we have Mrs. Archana from Slate School, and she is the dean of Cognibot and also the Slate School group of schools. And she has been instrumental in introducing school level nutrition related skill based activities. And of course, we have a star today, Anupriya. So, quick introduction of all the panelists, and then we'll go ahead with questions. Over to you, Sushmita and Kriti.
Yes, sir. We are privileged to have a distinguished panel of experts to guide us through this discussion today. It's my pleasure to introduce our first panelist, Ms. Darshana Sutar, serving as the officer in charge of the Gender Equity Branch under Samagra Shiksha, Gujarat. Ma'am has over 15 years of experience in the education sector. She has been associated with the Samagra Shiksha since 2010. Ma'am has led several initiatives focused on advancing gender equity and strengthening educational access for adolescent girls across Gujarat. She oversees the implementation as well as the monitoring of Kasturba Gandhi Balika Vidyalayas and other gender-focused interventions, ensuring that policy commitments translate into effective on-ground actions. Her work includes institutional strengthening, capacity building, residential schooling for girls from disadvantaged communities, and the integration of holistic development approaches within the school ecosystem. We welcome you, ma'am. And next, I am delighted to introduce our next second panelist. Our second panelist, just a second.
It's all right. Go ahead. No problem. Even if the slide isn't there, please go ahead.
Yeah. Our second panelist, Dr. Naini Dharmakirti. Ma'am is a health and nutrition officer at UNICEF. Ma'am has begun her career as a medical doctor in 2011 and holds a master's degree in public health. Ma'am has previously worked at World Health Organization, Sri Lanka. She has led the implementation of the Nutrition Environment Assessment Tool for schools in Sri Lanka, making it the first country in South Asia to adapt the tool and conduct the assessment. We welcome you, ma'am. Now I would like to continue introducing our third panelist for today, Dr. Tina Raval. Ma'am is a senior research scientist at Public Health Foundation of India. Ma'am holds a PhD from Maastricht University. She has extensive expertise in public health nutrition, adolescent health, and school-based health promotion. Ma'am has over 15 years of experience in research, program implementation, and policy engagement. She has contributed to several national and international funded projects focusing on healthy food environments, non-communicable disease prevention, tobacco cessation, and youth engagement. The major part of her research includes strengthening the food environment and adolescent health. Now I request my colleague, Ms. Kriti, to introduce the other two panelists. Thank you.
Yes, please. Kriti, go ahead. Don't worry about slides. Please just go ahead.
It gives me great pleasure to introduce Ms. Archana Rangi, Dean of Cognibot and Slate Group of Schools. She leads academic innovation and promotes holistic education across the institution. She is deeply committed to student well-being and works to build value-based school system that develop both learning and character. Her leadership focuses on helping students turn knowledge into responsible actions in their daily lives. She also guides mentors to encourage critical thinking, wise choices, and healthy decision making among students. Her vision is to create school environments that build competence, strong character, and long term well being. We are pleased to have you here, ma'am. अब मैं आप सबको एक प्रेरणादायक और जागरूक युवा का परिचय देने जा रही हूँ, मिस अनुप्रिया, जो एसएस दोरांदा स्थित +2 गर्ल्स हाई स्कूल रांची झारखंड की कक्षा 9 की छात्रा है। पिछले 4 वर्षों से मिस अनुप्रिया एक सक्रिय चाइल्ड रिपोर्टर के रूप में कार्य कर रही हैं, जिसके दौरान उन्होंने बच्चों और किशोरों से जुड़ी कई समस्याओं को उठाया है। अपनी आत्मविश्वास भरी बातचीत और बच्चों की बात स्पष्ट तरीके से प्रस्तुत करने के कारण उन्हें अधिकारियों और नीति निर्माताओं से भी सराहना मिली है। आप सबको ये जानकर गर्व होगा कि उन्होंने अपने क्षेत्र में बाल विवाह रोकने की भी पहल की है और चाइल्ड रिपोर्टर्स प्रोग्राम के माध्यम से उन्होंने पोषण और स्वस्थ खान-पान की अच्छी समझ विकसित की है और बच्चों व किशोरों को बेहतर आहार अपनाने के लिए प्रेरित किया है। उनका सपना आईएएस अधिकारी बनने का है ताकि भविष्य में वह बच्चों और युवाओं के लिए नीतियों में योगदान दे सके और उनकी आवाज को और मजबूत बना सके। मिस अनुप्रिया, हमें बेहद खुशी है कि आज आप हमारे साथ हैं। आपका हार्दिक स्वागत है।
Thank you very much for that introduction. And then we have a really good panel with us. Uh, I'll start with uh, our in person involved in girls' education in Gujarat, and Gujarat has really done extremely well in terms of improving Beti Bachao and Beti Padhao program, which has actually set uh, a path for the rest of the country to adopt. Uh, Dr. Darshana ji, thank you very much for joining us. Just want to know what was Gujarat's approach and what were the key strategies of integrating nutrition literacy into school education, and what are the kinds of skills that you are aiming to inculcate into the students?
Thank you, Dr. Subbarao.
Yes.
I'm
Yes,
audible?
yes, yes,
Yes.
yes, ma'am.
Okay. So I want to start my talk with some Sanskrit sloka, that is Shraddha Meda Yasha Pragya Vidyam Pustim Shriyam Balam Ayushyam Teja Arogyam Dehi Me Havyavahan. This is prayer to Agni Dev that we want pusti and arogya, that we should have in our Sanskrit literature. It says that we should take care of our health and nutrition. So, regarding the question, in Gujarat, we believe that learning about good food is just as important as in learning math or science. We want our students to be food smart. To achieve this, Gujarat has taken a structured school-based approach to integrate nutrition literacy into education under the leadership of State Project Director from Samagra Shiksha Gujarat. This is implemented through the Poshan Pathshala module. With the help of UNICEF, we have developed the Poshan Pathshala module, which was developed in Gujarati and aligned with the Ayushman Bharat School Health and Wellness Program guideline. We hold the 15 to 20-minute sessions during the school assemblies or class time. No lectures, only fun. Instead of just reading books, adolescents learn through games, quizzes, habit forming tools, and group talks. When they have fun, they remember the lesson better. We focus on real life. We build skill to improve how students eat by using local foods that are easy to find. We also help them develop a very important skill, reading food labels, so that they tell the difference between healthy food and the junk food. This includes anemia prevention through IFA compliance and deworming, as well as the importance of personal and menstrual hygiene. The skills we want students to develop are thinking for themselves, so they can choose the healthy food over the ready to eat unhealthy packet food. Building good habits like washing hands and eating healthy meals every day. Helping their friends. We want them to lead their friends in staying healthy. Taking charge so they feel proud of living a healthy life for a long time. Our practical focus areas includes dietary diversity, using locally available foods, anemia prevention through IFA compliance and deworming, menstrual health and hygiene, personal hygiene, and informed food choices such as reading food labels to distinguish healthy food from junk food. The skills we aim to develop among adolescents are critical thinking for informed food choices, building healthy dietary and hygiene habits that are sustainable, strengthening self-care and peer leadership in areas like anemia prevention and menstrual hygiene, encouraging ownership of healthy lifestyles that contribute to long-term well-being.
Yeah, thank you very much. I think it's very important point that you've raised, and then you said, in the form of habit forming tools and also what they enjoy to do most. That's a big takeaway for us. I think I request you to please stay on with us for rest of the questions. But now I will move over to Dr. Naini, who's been patiently waiting for a long time. The need as tool or needs tool that has been talked about by Dr. Allison has been used in the context of Sri Lanka, and then we discussed it over several cups of tea in our previous meeting. But now I think it's time for you to tell us what were the key outcomes that you saw on implementing these in schools, and which schools did you adopt in Sri Lanka? And then once you implemented this tool, how were the findings of this tool translated to policy changes, if at all anything has happened? So there are two aspects to it. One is to administer it and then find out what's the food environment or what's ailing the food environment, and then taking corrective actions through policy interventions. These two dimensions, if you can quickly throw light on. Your mic is off, Dr. Naini.
Right, I'm better, I assume. Right. So thanks, Dr. Subbarao, and thank you, Preetu, for getting Sri Lanka engaged. And Alison, it's great to hear from you how this overall framework is was based on, and now I'm very happy to present how we have taken up from that and moving ahead. So Sri Lanka did the NEET test assessment in 2024. We concluded the study by 2025, early 2025, first quarter. Just to give you just a background for Sri Lanka, why Sri Lanka decided to take it as the first country from Southeast Asia is that we had the Global School Health Survey, which shows that our adolescents were having very unhealthy behavior. Almost 20% of them had daily carbonated drinks, very unhealthy sugary salty beverages, and on top of that we have the malnutrition and overweight obesity rates rising. And UNICEF Rosa had done a young people's perspective where there was an enabling environment where the young people wanted to have a change in their food environment. And we also had some systematic challenges that Sri Lanka had the Food Act, which was implemented which was brought into action in 2022, but was not implemented up until 2025. It's been getting delayed due to a lot of industrial influences. So in that background is why we thought we'll have the NEET test assessment in 125 schools across urban, rural, estate districts of Sri Lanka, and also covering private government, religious schools, and also special schools. So we wanted to bring in that baseline. So the evidence based on the NEET assessment was mainly, as Alison explained, the five thematic areas in NEET assessment. The first thematic area was mainly on nutrition and lifestyle education. So in Sri Lanka, we do have nutrition education incorporated into the mainstream school curriculum, so which is something we've been having for years, but we still wanted to know how much it's implemented, how effective it had been. So one key finding that we found there was that Sri Lanka does not have enough human resource teachers who are trained specifically to deliver nutrition education for students. They were sometimes, in fact, to a level, there was only 25% schools who had a dedicated teacher for trained for health and nutrition. And this also, I mean, they change depending on the availability of teacher. And it was very evident in the rural sector, specifically in the estate schools, there were no teachers available to teach the nutrition education. I will be only highlighting very key findings in each thematic areas. We of course have ample of information that we had gathered. Now moving on to the second thematic area, the nutrition food in schools and beyond. So we have a school meal program, free school meal given to all primary schools and schools less than 200 children. This is given by the government. Initially the World Food Program supported, now taken up by the government. government. So in that there is a dedicated menu. So in this also we saw certain gaps. There were about 7% of the schools had no vegetables at all on the day of servings, 20% had no fruits, and about 5% had no protein sources. And specifically in the rural setting, egg were the main protein source, and it differs from the area to area. And like Alison said, we promote the locally grown vegetables and foods for this full meal program, which was not also very much evident. And there was also a very finding that we saw because of need that in certain rural schools, there is a about 50% schools had an additional program going on based on the something that the parents committee says, you know, this is good for child's liver. If someone signs that in social media, they decided that they give it to the whole school. So that kind of unregulated meal programs were also ongoing. And also certain the containers that they carried. I mean, at one point we found there were very toxic kind of use containers that were used to deliver other toxic materials. Chemicals were cleaned and taken to serve food in the school meal program. So that kind of overall findings were there. In thematic area 3, which is more relevant to this discussion today, the healthy food environment in school and beyond. So the school canteen guidelines were being developed for Sri Lanka at the time, and they have identified two kind of food in red zones. It was mainly fried and sweetened food, and in the green zone were the foods that were healthy to be displayed in the canteen. So almost like about 80% of the schools in all urban, rural, estate, all sector, they had fried and sweet food in their canteens, and they had sweetened drinks more than 50% of the canteens. And also there were food outlets outside canteens where the 25% of the children in urban sector were allowed to go outside and buy during school time, which was again a very unhealthy practice. And there were in rural setting, there were vendors who were coming inside school to sell this unhealthy food. And then of course food promotion around about 100 meters around the vicinity of the school, we could see almost 50% of the places they had food outlets, they have advertising boards, and they also had posters. But when it comes to advertising within school. So by 2025 January, we were able to implement the Food Act, where under 12 children under 12 were not entitled to be displayed in any of the food advertisements, be it posters, be it social media, be it marketing. So only 6% of schools had advertising within schools, which was a very positive finding for us. And also over the last year, when we were inquiring from the students, they said at least about 48% of the schools had some kind of unhealthy food promotion during their school events, be it a sports meet, be it a children's day, or any kind of event. Then moving on to the fourth theme, that was access to essential micronutrients. The iron folic acid supplementation happens weekly for 6 months in Sri Lanka for all school children. This was very well received by in almost all the schools, except for the urban private schools, which are not connected to the government. But the consumption rate in the government schools were as good as 90%, and it was mainly the dots approach. I mean, they were consuming in front of the teacher in the class in 90% of schools. And the last theme is a nutrition screening of special cases and the follow-up for risks. So we have grade 1, 4, 7, and 10. All the grades in Sri Lanka has a school medical inspection that happens annually. So in all the rural settings in the government schools, this was happening 100%. And again, there was a disparity in the private schools that are in the urban settings mostly. But the challenge and the deficit that we find was, although the reference were given for these nutrition issues in children, there had been only about 50% details for the follow-up and the, but actions have been taken. So that covers our findings mainly on NEET assessment that is related to that. So based on these findings, so Bharao, we actually kind of had our recommendations on main three thematic areas. Like first one was streamlining the implementation challenges in nutrition education and the meal program. So these identified challenges were communicated to the Ministry of Education, Ministry of Health, and all the zonal education officers and also a report was given to each school. So it was kind of shown in which school these regulations were not happening, specifically when it comes to the education, the curriculum, and the meal program. And this was brought into the this Ministry of Education School Health Branch also had taken this into consideration, and they are looking into the schools that have identified the gaps. And the next main theme was advocating, promoting, and implementation of the healthy school food environment within and beyond school. So one main thing that we were able to do in this was that before starting the assessment, we had this core group which incorporated experts from Ministry of Education, Ministry of Health, academia, and even from the other UN agencies. So we had a very co-expert group who were involved with this from the start. So this group was very much helpful in us when we were taking forward the recommendations. So we managed to have the healthy canteen guidelines updated based on
Okay.
the findings of the NEET assessment that is happening in all the schools in Sri Lanka with the canteens, that is about 2000 plus schools. And
Okay.
then there is a canteen assessment form that happens mainly on it was mainly based on the hygiene of the food. But now we
Okay.
managed to add the color coding, the red colored and green colored, like, the fried and sweetened food availability and also healthy food availability into the canteen assessment form, which grades the canteen as grade A and B. So if you even have any fried item or any sweet
Okay.
item, it goes as to a B. So only the canteens with healthy food gets the A grade. And this again goes to the annual health promoting school evaluation, which happens in all 10,000 schools. So that the indicators that we found from NEET were incorporated into the health promoting school evaluation tool, which we kind of finalized this year. So from next year onwards, all the schools with in 10,000 schools in Sri Lanka will be evaluated using this health promoting tool. And
Dr.
the
Naini, I'll
school,
just come back to you with more questions on
sure, sure,
how
sure,
phase-wise it has been implemented by various
understand.
departments and also
Yeah,
by the schools. I think that
right.
reserved for
Thank
the
you.
second round of questions. I will now move to Dr. Tina Raval. Tina Raval has also implemented this in Indian scenario. Quickly, Dr. Tina, please tell us what are the important, how it was implemented, and what are the key takeaways. We'll come back to uh, the perspective of what school administrations can do at a later point of time. If you want to use a slide, as you said, you can please go ahead. She requested to
Thank
use a slide. She can quickly use. No issues.
Thank you so much, sir. I think it's always a pleasure to be part of LFOF consortium and to contribute as we have been doing, I think, since 2020 and how we have been contributing. So just quickly go into I think, move to the slides. But before that, I think I really inspired and motivated by Anupriya's clear vision of becoming a bureaucrat and IS officer. So that's why I think it is very, very important to have adolescent voices to be heard because with so much of clarity, I think it's every program, not only their vision, I think in the future, but how they can contribute to our ongoing programs and initiatives where they can be the equal stakeholders. So thank you, Anupriya. That's very, very motivating. So I just thought maybe I'll just mention it before initiating the slides. So thank you, sir, I think for allowing me to share my slides. Before this, I think we have heard a lot about the need to what we have been since I think morning. Uh, if it is visible, please let me know. And I'll just move the slides to the slide mode. So quickly, looking at the time, I think I'll not spend too much of time why it is important. So similarly, since morning, we have been hearing that there is a triple burden of malnutrition, especially among adolescents. So there is a need to address those food environment, which is like influencing the food choices, especially for the adolescents, and which results including the rising consumption of processed and the ultra processed food, physical inactivity, and unhealthy food dietary patterns, which are the major contributors to this triple burden of malnutrition. And adolescents, we have heard, I think, in the previous slides, adolescents represent a critical window to address these nutritional challenges. And alignment with the national and the global initiative, it is essential for strengthening the food environment and promoting lifelong healthy eating behaviors. And school, of course, provides a wonderful setting which should need to be regularly assessed in terms of the type of food available in the canteens, meal programs, ensuring alignment with the nutritional guidelines. For example, in India, those are promoted by FSSAI, for example, limiting the sale and promotion of HFSS food. And we have been hearing about the
Tina, your
UNICEF tool.
slides are not moving if you are moving the slides. Yeah,
Yeah,
okay,
so
right.
this present initiative is aimed at adapting and pilot testing the UNICEF need tool to assess and strengthen the food environment in context to the Indian setting. It was a cross-sectional study where we have adopted the mixed method approach, and it was conducted in 2025. Uh, it was conducted in 10 schools of private schools of two districts of Uttar Pradesh, which includes Gautam Buddha Nagar, that is Noida, and Ghaziabad. And it conducted in two phases with the major objective of adapting the NEET tool in the Indian context and pilot testing it in the selected schools of these two districts. The major components we have heard in the earlier slides, but this is about what the tool is all about and how and what components they have included. So first is the questions for the direct as an observation, which included total of 22 questions to examine the availability, variety, quality of the food and beverages provided or sold within the vicinity of the schools, observe the infrastructure, hygiene, compliance with the national food safety, food hygiene guidelines, assessing the promotion marketing practices. The questions for the school administrator, which includes principal, teachers, dietitians, nutritionists who are part of the school system to understand the school level policies, to capture details related to nutrition education, partnership monitoring systems, and students' attitude and perception. The questionnaire which explore the students' perception of food choices, meal quality, affordability in and around the school campus, assessing their awareness, their preferences, peer influences on dietary and physical activity behaviors, to understand students' engagement, empowerment in promoting healthy diet, and the dietary quality questionnaire, which included in terms of the 32 questions to evaluate the overall dietary quality in terms of 29 standardized food groups, identifying the gaps in the diet diversity, prevalence of ultra-processed food, and the evidence to complement the qualitative insights as a part of the NEED tool. So the methodology included two phases, where one is in the terms of the contextualizing and adapting the NEED tool, and second of the pilot testing of adopted tools, this NEED tool kit, which included desk review. The first phase included the desk review, in-depth interview with the important stakeholders at the national and the state level, school stakeholders, which included administrators, parents, and students themselves, and the tool drafting and how we have just pilot tested in the phase two. So quickly, I'll just maybe share some of the major findings. The report is in the process of the finalization, so it will soon be available in the public domain. So in total, we have conducted 25 interviews as a part of the qualitative component. Thematic analysis, including the deductive and inductive emerging themes, were used as a part of the analysis. And in terms of the quantitative, we have pilot tested it with the 10 schools, where the more than 300 students participated in the questionnaires, and they responded in terms of the different tools. Observation checklists were created for 10 schools, administrator questionnaire for 10, then the student questionnaire, and the diet quality administrator again with the students. So major thematic area which was obtained as a part of the qualitative theme, and the major themes in the illustrative codes which have just showcased in the slide. So I quickly go into the themes, which included the food preferences at home and the school level. So mostly students have mentioned eating unhealthy food like chow mein, burger, and they preferred such foods because that's really and easily available. The younger kids are more into eating pattern which has been provided by parents. In terms of the school food and physical and activity environment, in some of the schools, the physical activity, for example, the swimming is compulsory for up to 8th graders, but beyond 8th graders, because of the academic pressure, it dilutes. Then there is a need for, which has been highlighted as a part of the teachers' discussions, that there is a need for a space and more activity-oriented approach at the school level. Nutrition services in terms of in schools, so there was no regular supplementation of iron tablets. There was no health checkups, which happens only once in a year. And there is a need for records and creating this evidence available. nutrition, health education in schools, environmental sustainability in terms of banning the single-use plastic. So those were also the themes where we have generated, and also about the determinants of healthy eating, where social media, I think, has come up with a greater influence of influencing the healthy dietary pattern, especially among the adolescents. And due to the time constraints, parents give pocket money there because of their working parents and children's were decided. I mean, they were taking more of the canteen menus. In terms of the feedback, what we have received from the NEAT tool, so the tool may reflect on the what changes is needed as per the school's requirements, included the sanitation and hand washing questions also as a part of the tool. And it was very important whether canteens were not included or adapted. In phase two, which included the compiled, I think,
Tina,
compiled findings.
you have about 30 seconds.
Yes, just quickly. So, in terms of the school finding environment, so school meals and snack programs, there were out of the 10 schools, only one had a meal or a snack program. But most of the most of the schools they have the ultra processed food, both available in meal or the snack. Food sold in schools. So 40% schools they are selling foods and drinks through canteen, which is mostly sugary drinks, fried items, salt, and packaged food. In terms of the policies, 90% schools reported the healthy policy, but most of them were not in the written format. None of the schools had a kitchen garden. 40% schools influences by the external food vendors. In terms of the nutrition education, so most of the schools they have mentioned that they have a dedicated nutrition sessions, but it's less than 30 minutes in a week. In terms of the physical activity, so there is a need for educate spaces, but I think most of the schools have mentioned that they have this available playgrounds. In terms of the wash infrastructure, so all the schools had toilets, but 70% had only with the clean soap equipped hand washing stations.
Okay.
Safe drinking water was available, but 20% they have the limited one. So quickly into the students' perception. So I think only 17% of the total population have mentioned that there is an availability of the nutritious food. There is a strong support for a daily physical activity, but at the same time, students who have shown dietary diversity, but in terms of when it is talking about the quality, it is most of the ultra processed food. So quickly into the policy
I'll come
actions.
back to policy actions at a later stage.
Sure.
Just
Thank you
hold
so
them
much.
for yourself. Yeah, thank you very much, Tina.
Sure.
And then we'll move on to Mrs. Archana Rangi for her views. Thank you for patiently waiting. And then we just want to know, as an administrator of a school, what is that you see as the role of schools in promoting healthy eating, and with an example of what you have done for your schools, and then how do the students take it and how do parents react to it?
Number one, here we believe, rather, I believe in my schools that it is the environments that we shape, and the environments in turn shape our children who happen to be the future. So, as a case study, I'd like to explain to the entire panel the kind of steps that we take to ensure that children are having what we label as nutritional literacy or nutritional intelligence, as we prefer calling it. So, we have the snack break, as we call it in all the schools, which comes around 10 o'clock in the morning. Every day of the week is given a name. For example, Monday, we call it the Munchie Monday in our school, where we encourage children to bring dry fruits as part of their little amount of good fats that needs to go in, and their omega-3 fatty acids, or you name it, a little bit of fiber, that which is otherwise absent in their diet. Moving on to the next day, that is Tuesday, is calcium-rich Tuesday, when children bring in their calcium-rich foods. You call it paneer, the curds, or your mushrooms, all the food that is calcium-rich, even guava for that matter. And Veggie Wednesday, they are encouraged to bring vegetable salad. Tasty Thursday, as somebody on the panel rightly said, it's a cheat day. But yes, no junk food allowed on campus, no packaged food as such. As long as your mama is making it in your kitchen at home and it is not made of any of the four white poisons, it's allowed. You can cheat. And Fruity Friday, as the name itself suggests, children are encouraged to bring fruits. Again, not the imported or exported ones, but basically the seasonal fruits. Salad Saturday, without adding any custard or any kind of chemical, things. It's just the fruit bowl or your vegetable bowl and whatever you want to put into it, minus the milk also. So that's salad Saturday. And why do we leave Sunday out alone? Because children get to spend time with their parents, and educating children essentially involves educating parents. And therefore, Sunday, we call it the super home food Sunday, where children sit with their parents and prepare their meal plan for the entire week and tell us what they have made. So this is the week plan for what we have for the break in the morning. And our lunch program is also called Protein Lunch, where we give children very healthy carb control diet, as we also understand that carbs are very essential for children because they're in their growing age, be it as adolescents or be it the toddlers, irrespective of the ages. But the portion of protein is properly given to them with regard to their fibers. We have the salad every day that is served. And what we serve in our school canteen, unlike what the other panelists have said, is all homemade hot food, be it roti and paneer ki sabzi or aloo ki sabzi with mutter to balance the carbs there, or be it the lentils that we give as part of their sambar or dal. And we encourage children to take millets at home. Initially, as Dr. Subbarao has pointed out, this is very challenging for us when we started this, especially we've been doing this for the past 2 decades, 2 and a half decades that we've been in the industry. But post-COVID, when children started coming back to school, we've observed increased rate of obesity and if I may say, laxity and laziness among children, owing to the fact that they were confined to the four walls of the house and the food habits not going monitored. So we've taken it up as a missionary approach and ensured that everything fell in line. As they rightly said, it has to start from school, not from home. It has been very challenging for us to explain to parents, because we've working mothers on our parents list who find it very easy to rip open the packet and put it there in the box and send it. So right from asking them, educating them not to send food in the plastic wares, why it is important to send it in steel boxes, educating them not to send water in plastic bottles, for that matter, not even in copper bottles, because holding it there is pumping copper into their system. So it has definitely been challenging. But as they rightly say, it is when the stakeholders take it up on them as a responsibility, as a shared responsibility, probably we are now able to see the difference in our children, starting from the prep school to the 10th graders and the 11th graders. We're able to see the difference in children, and it is definitely the contribution of not just the management but also parents, and most importantly children.
Okay. By the way, do you also have school served meal in the school? Is
Yes,
there
we
a
do have school served meal, and we stick to what we say they're supposed to get from home. The same thing is served in the school canteen as well.
Yeah, that's very nice to see. I think these are some of the initiatives that can be, if you want to join our Let's Fix Our Food initiative, we can just, mention some of them, perhaps discuss a few of them and their feasibility, and then perhaps a bit of a, scientific backing to what is to be done or what is to be revised.
Absolutely.
That's a good thing, very, very good thing. And now we'll move to our star speaker for whom we've been waiting for a long time. Um, Anupriya, thank you. आप इतनी देर हमारे साथ जुड़े रहे, और हम आपके पास आएंगे। पहली क्वेश्चन ये होगी कि आपने फूड एडवर्टाइजमेंट्स पे भी क्वेश्चन करना शुरू किया। आप जब ये फूड एडवर्टाइजमेंट्स देखते हैं तो उसमें जो क्लेम्स बनते हैं, जो अपने आप अपने फूड के बारे में बहुत ज्यादातर वो लोग बात करना, वो पैक पे ऊपर बड़े बड़े पिक्चर डालना और बड़े क्लेम करना, ये सब होता है, उसको आपने क्वेश्चन किया। ये किसी ने आपको ट्रेन किया इसमें करने के लिए, या आप खुद से आप इनिशिएटिव शुरू करें? और उसके बारे में थोड़ा हमें बताइए। लेबल रीडिंग और उसके ऊपर जो आपने काम किया, उस उसके बारे में थोड़ा हमें बताइए प्लीज।
यस सर, मुझे सिखाया गया है कि कोई भी फूड एडवर्टाइजमेंट पे हमें सीधे ट्रस्ट नहीं करना चाहिए। स्कूल में भी टीचर्स ने बताया है कि ये जो टीवी और मोबाइल्स के जितने भी एड्स होते हैं वो ज़्यादातर प्रोडक्ट को सेल करने के लिए होते हैं। इसीलिए हमें सबसे पहले ये देखना चाहिए कि वो जो फूड है वो रियलिटी में हमारे बॉडी के लिए हेल्दी है या नहीं है। घर पे मम्मी पापा भी कहते हैं कि कोई भी स्नैक चूज करने से पहले हमें उसकी एक्सपायरी डेट और इंग्रेडिएंट जरूर चेक करना चाहिए। इसी से मैं इंस्पायर होकर मैं कोई भी प्रोडक्ट चूज करती हूँ तो वो सबसे पहले मैं उसके एक्सपायरी डेट और इंग्रेडिएंट जरूर चेक करती हूँ, और वो हमारे बॉडी के लिए हेल्दी है या नहीं है ये भी चेक करती हूँ।
वेरी गुड, थैंक यू वेरी मच। और आप चेक करते हैं, और आपके साथियों को भी इसके बारे में पढ़ाया आपने?
यस मैंने अपने फैमिली से तो मैं सीखी, और मैं अपने जितने भी क्लासमेट्स हैं उनको भी बताया, और जो मेरे बगल में बच्चे जो रहते उन्हें भी ये चीज़ बताया था कि हमें कोई भी प्रोडक्ट चूज करने से पहले उसके एक्सपायरी डेट और इंग्रेडिएंट्स जरूर चेक करना चाहिए।
अच्छा, अगर आप स्कूल की हेड बनती है या प्रिंसिपल बनती है या स्कूल में कोई चेंजेस लाना है तो आप क्या करेंगे? ये पोषण के बारे में बताने के लिए या हर तरह के सब्जियां तरकारियां या विविध प्रकार के आहार जो खाने के लिए, जो आप खाद्य पदार्थ खाने के लिए आप जब बच्चों को पढ़ाना है, आपके साथियों को पढ़ाना है, मानिए आप स्कूल के प्रिंसिपल बने, तो आप क्या करेंगे? क्या सुझाव, क्या सुधार लाएंगे आप?
तो अगर मैं स्कूल की प्रिंसिपल होती तो मैं सबसे पहले ये इंश्योर करती कि जो मेरे स्कूल में जितने भी बच्चे हैं वो अपने टिफ़िन में अनहेल्दी फूड ना लेकर आए, और अगर बच्चे घर से टिफ़िन लेकर आना भूल जाते हैं तो वो, अगर उनके पास पैसे हैं तो वो बाहर से कोई अनहेल्दी फूड ना खरीद के खाएं। इसी के लिए मैं सबसे पहले स्कूल में अनहेल्दी फूड को बैन करती, और साथ ही में मैं एक छोटा सा अवेयरनेस प्रोग्राम भी रखती टू टुवर्ड्स ईटिंग हेल्दी फूड, जिसमें मैं बच्चों को हेल्दी फूड के इम्पोर्टेंस के बारे में बताती, और साथ ही अनहेल्दी फूड के हार्मफुल इफेक्ट्स के बारे में भी। मैं बच्चों को यूनिसेफ के द्वारा चलाया गया प्रोग्राम मेरी थाली सेहत वाली के बारे में भी बताती और बच्चों को उनसे जोड़ती, ताकि बच्चे जो है वो अपने सही खान पान के बारे में जान सके और अपने फूड में ज़्यादा से ज़्यादा लोकली अवेलेबल फूड ले, क्योंकि ये जो फास्ट फूड होते हैं वो देखने में और खाने में भले ही अच्छे लगते हैं, पर वो हमें 0% ऑफ न्यूट्रिएंट्स देते हैं। बट जो लोकली अवेलेबल फूड्स होते हैं वो हमारे बॉडी को वो सारे एसेंशियल न्यूट्रिएंट्स देते हैं जो हमारे बॉडी के लिए इम्पॉर्टेंट है, जैसे कि कार्बोहाइड्रेट, फैट्स, विटामिन्स, मिनरल्स एक्सेट्रा। ये अगर बच्चे ये नहीं खाएंगे तो वो जो नॉन कम्युनिकेबल डिजीज होते हैं जैसे कि ओबेसिटी, एंजाइटी एक्सेट्रा, और जैसे कि ब्लड प्रेशर, हार्ट डिजीज, ये सभी से सेफ रहेंगे, और ज़्यादा से ज़्यादा वो हेल्दी फूड खाएंगे और अनहेल्दी फूड को अवॉइड करेंगे। सही
Thank
है।
you. For those of you who did not understand Hindi, I'll just quickly say what I spoke to. Anupriya. First I asked her if she was taught about label reading by anyone. She said her family helped her. So that really brings to a very important finding and understanding. The role of family is very, very important. And then when she started learning, she also started educating her friends and others. And then I asked, if you were the principal of your school, if you were to change few things, what would you do? She said she wouldn't allow anyone to get unhealthy foods or junk foods in their tiffin boxes. That's the first thing that she would do. If somebody is not getting and then they are given money to buy, she wouldn't allow them to buy anything outside the school also that is unhealthy. And she said UNICEF's Meri Thali Sehat Wali, that's my plate, which is nutritious, is a program that UNICEF has brought out. She said she would make every one of her friends or school children to go through it and then pick up some good habits for themselves. थैंक यू अनुप्रिया, आप हमारे साथ जुड़े रहिए, हम फिर वापस आएंगे आपके पास. तो we'll just go to Dr. Darshana once again if she's still available. I hope she's available. Darshana ji, please tell us the entire process of developing the curriculum and how did you involve students and communities? If you are here, yeah,
Yeah, I'm here.
yes, please.
We have not designed this Poshani Pashala tabletop exercise. We took the feedback from the stakeholders, listening to teachers. Teachers and staff told us that the old materials are there. It is there written in our textbooks and the, as I said, Ayushman Bharat guidelines. But they need the practical approach to implement it. So they wanted something simple and practical. Their feedback is the foundation of this program. With the help of UNICEF, we created the guide that the easy for staff to use and fun for adolescents to follow. Uh, Talking with students too, UNICEF team talked to the adolescents to understand their challenges, like why they prefer packaged snacks over the healthy sprouts or milk or that diversity in their our routine life. This helped us make the lessons for interesting for them, involving parents also. In our Kasturba Gandhi Balika Vidyalayas, we took feedback from the parents and also we told them to parents that the healthy habits adolescents learn at school continue at home also. Student leaders, a great example is our HB teams, that is hemoglobin teams. These are the groups of students who support each other to stay healthy and prevent anemia. It shows that when students lead, change happens. That we just listen our Anupriya Kumari. So far, we have reached 30,000 girls in our first phase, and response has been wonderful. Till today, we have implemented into 43 KGBVs and 30,000 girls. We are now moving to our PM3 schools, that is 400 plus, and will eventually reach every government schools in Gujarat. We are not just teaching a lesson, we are empowering a generation to grow up strong and healthy. Thank you.
Thank you very much, madam. I think I'll get back to Sri Lanka again to ask Dr. Naini. Just tell us in 1 or 2 minutes what were the key challenges to you encountered based on neatest tool. If you when you were suggesting changes for school level policy for the education ministry level initiatives, and how
Right,
did you
yeah.
navigate them? Yeah.
Okay, yeah. So actually now, like I mentioned, we did, like, the Ministry of Health and Ministry of Education of Sri Lanka have a very good relationship when it comes to the units of nutrition, school health and nutrition. So they have been working throughout the year. So it's an opportunity that we leverage us in this case. So, but I mentioned, now we do have all these guidelines going into schools, but the main challenge we had was the implementation and also the lack of HR. Like I told you, the teachers, lack of teachers, and also lack of staff like the public health inspectors to monitor these interventions. So when we utilized this, I think this was like, actually we gave this as a good baseline evidence, because one challenge was that Sri Lanka did not have enough data to bring in these policies also, and to show that how important the school food environment is and how it's been affected. So the 125 schools, which covered almost all the entities of the country, and also which covered about 3,000 students, gave enough evidence, baseline evidence. So one thing we did was we informed all the zonal education departments, which are covering all the 9 provinces, the findings that were related to their each and every province, which were the challenges they had in their system, like in the nutrition education in schools, for example, the lack of teachers, and then about the deficiencies in the school meal program. So we brought that into the like uh, evidence to the administrators for them to take action in the specific areas that were lacking. And then specifically in the monitoring component, we were able to add these indicators into the national level monitoring.
Wow.
So like I said, the school canteen will be all monitored from this year onwards, and they will be given grades at A, B, and C, and the C ones will be given like notifications to improve, and then A and B grades will be sustained, and that becomes a responsibility of the school principals, and also monitored through the zonal education system. And again, this health promoting school evaluation, the indicators we have been added to with the NEET assessment indicators, will be done by both Ministry of Health and Ministry of Education together annually, and these findings will be assessed as bronze and silver and golden level school awarding
Oh,
kind of an initiative that will be done at the national level. The
so
schools
you've
will be
incorporated
recognized
this in the
in
school
the
assessment program, national school
national
assessment.
school assessment, in the health
That's really
promoting
good.
school assessment. So like I told you, one like very good strength we had was we had this core group which had all these experts who were part of it. So when we were taking the policy decisions, it was quite easy. And also based on this, now that we have the food act, because we have this implementation challenges, we've also proposed the legal landscape analysis, where UNICEF will be supporting to identify the
True. Yeah.
implementation challenges, where we can bring in expertise to support. And also of what I hear, this the the bringing in the champions from children and the
Yeah.
parents is some
Yeah.
initiative that they are taking forward with the school health promoting clubs in school, where the Ministry of Education has also come forward to get our support in getting this initiative, where we are going to have this voice of children
You
as
mean to
their
say
right.
clubs, is it? The school
They
nutrition
have a
clubs.
school health clubs in all schools, which
Okay.
had not been very active. But this year we are targeting it for them to bring in this school food environment strengthening as their target for this year. Maybe they will be able to assess their canteens. They will also assess the food outlets around their schools. So that kind of initiatives are things that we are looking at for this year.
Okay.
But with the system level, we've been able to kind of strengthen all the monitoring mechanisms based on the NEET assessment
Oh, wow.
findings.
That is really
Thank you.
good. Thank you very
Yeah.
much. Tina, can you quickly say from here where? You've done quick assessment and then what?
So I
The
think
last few
quickly,
points.
yes. So
Yeah.
quickly, the priority actions based on the pilot and the what we have done in few schools. So there is a need to strengthen the HFSS regulations and the food marketing control. There is a need for a standardized nutrition food provisions and to improve the, especially the service delivery and improve the access for the healthy food environment. There is a need for nutrition education, digital literacy, physical activity promotion, preventive adolescent health and anemia control, strengthening the monitoring data system accountability, and most important, the strengthening the family, community, and adolescent engagement. But at the same time, how we can scale up this NEAT tool at the larger level where we can implement this in the larger number of schools. But at the same time, maybe contextualizing it for the government school as well, where we are looking at the midday meal provisions, where we can have a healthier food environment as a holistic approach, including both private and the government school students. So over to you, sir, quickly.
Thank you. Dr. Allison, if I can ask you, I think that NEET as tool already has a scope for assessing different kinds of schools, whether they are supported by public government schools or faith-based schools or maybe private schools, isn't it?
Could you repeat the first part of the question? My
Uh,
internet.
yeah. Tina was talking about custom making the tool for government schools in Indian scenario. As
Yes.
you know, government schools in Indian scenario are, I don't know whether to say this or not, are uh, usually the government school services are taken by lower strata of economic strata of the country, wherein the richer and middle and upper higher middle class school higher class children go to private schools. But what I was trying to understand is the neatest tool has already been made in such a way that it can be adapted to faith-based schools, government schools, low-income schools, and others, right? If I'm not wrong.
Absolutely. And I think so the tool is the tool. And I think with the technical steering group, you would have to prioritize which demographics you would like to prioritize in the first round of data collection. But one thing to say, UNICEF leaves no one behind. But what we're seeing in our countries, middle income countries and lower income countries, that people from higher income groups, households, are faced with more UPF consumption, which has poorer health outcomes. So I would err on the side of let's assess all of them if we can, or at least a representative sample to see what the food environments are looking like.
Fantastic. Okay. Dr. Naini wanted to add a
Yes,
point
just
quickly.
to tell you, Dr. Subodh, that we did in Sri Lanka all private, public, the religious schools and faith-based schools, and special schools also. So it
Oh,
was a tool that can be
comprehensive.
used. Yes, yes.
Thank you very much. Getting back to Ms. Archana again, uh, you really set an example for a school to do what they have to, but I'm sure you would have faced resistance or still facing resistance from students, because for me or for anyone, taste is the biggest driver of food choice. Your When you place, kind of restrictions on what they can choose, it may be perceived as a restriction. In fact, how did you navigate this with, what were the challenges and how you navigated these policies with parents and the immediate community outside the school? Because there are a lot of these small time stores which sell all kinds of foods, and children after school hours or during breaks are their biggest market. So how did you manage these things very quickly?
We believe in NLP, positive NLP. So we've been driving it into their minds right from the time they enter the school gates. And luckily for us, around our campuses, we don't have these small time vendors or hawkers, who sell all these kind of things which are, unhealthy or don't fit into our chart of health. Point number one. Secondly, yes, we did face a lot of resistance from parents, not in terms of how do we do it, but in terms of the policies being very strict. As we rightly said, we don't allow them. We put it in bold that junk food is not allowed or packaged food is not allowed. You can't bring sugary soft drinks or cool drinks or tetra packs or those kind of things. What we basically did then was we shared evidence-based studies with both parents and children. We've shown them how their classroom behavior changes, how their overall growth patterns happen. So we've something called Sampurnata or holism as a part of our syllabus and curriculum, wherein we have mentors for each class who talk to children about their nutritional intelligence, who show to them all these sugar boards are there, and we show them what happens when there is a sugar spike, why they tend to feel hungry, though they eat their favorite food, as you rightly said, taste. That is the first thing that appeals, and that's the reason we have one cheat day, because they're children at the end of it all. And we did have the society also playing a huge role, because my friend gets to eat a pizza but I'm not allowed to eat a pizza, right? So we did have some practical studies wherein we've asked children to compare their lunch boxes. We've told them to study their energy patterns. Since we're talking about adolescents, when we talk about the younger age group, it's whatever the teacher says is the norm for them. But since we're talking about adolescents, the 6, 7, 8, 9, 10th grade children who tend to question every rule and every norm
Yeah,
that is there
yeah,
in school. So we've shown them the evidence-based, studies. We've asked them to read the food labels for themselves. We showed them how things can be very, very misleading, rather they are very misleading, and how a single cream biscuit, I'm going on record, a single cream biscuit itself has 17 chemicals, which when pumped in, what are the, demerits and the disadvantages of pumping all that into the bodies.
yeah. Okay, thank you. And I think this school was part of our initial read before you eat initiative as well, wherein we done some interventions with school children on promoting label reading. Thank you very much. I think uh, please set an example, and I'm sure you're part of many of these private school, teachers associations and school management associations. I think spread the word. Let's fix our food really, and then I'll अनुप्रिया मैं फिर आपके पास आ रहा हूँ. एक लास्ट क्वेश्चन आपसे. आप लेबल पढ़ते हैं, अच्छा खाना जो खाना है आप उसके बारे में बहुत ज्यादा चर्चा करते हैं, ये सब करते हैं, लेकिन आप जब खाना चुनते हैं आपकी पहली चॉइस क्या होगी? टेस्ट होगी, या लेबल पढ़ के लेंगे, या कोई फ्रेंड खाया तो इसलिए हम भी खाना है, ऐसा है, या और कोई? कहिए.
तो पहले मेरे लिए कोई भी फूड चूज करने के लिए उसका टेस्ट और प्राइस दोनों ही इम्पोर्टेंट था, क्योंकि मैं ऐसे स्नैक को चूज करती थी जिसके प्राइस को मैं अफोर्ड कर सकूं और जो टेस्ट में भी अच्छा हो. बट आफ्टर joining द चाइल्ड रिपोर्टर प्रोग्राम एंड अटेंडिंग द चाइल्ड healthy diet program, I aware and now I choose the food according to the health benefits and how much nutrients they give.
Fantastic. That's what is a child ambassador supposed to do. And please build many more child ambassadors like you. आपके जैसे बहुत सारे अनुप्रिया को बनाइए. हमें वही
So,
चाहिए. Thank you very much. And then it has been an excellent, discussion all through. I thank all the panelists and speakers. But before we leave, the 5 key takeaways, as we usually do in every e-dialogue. For me today, it has been very good. I take off from what our, a scientist director, representing director today, Dr. Bhanu Prakash, said in his initial remarks. Most literate people in this country are also likely to be nutritionally illiterate. And that's where adolescence is a key area. Taking off from what Dr. Allison said, school food environments definitely play a very important role, even to an extent that to help them catch up what they have lost out in initial days if there was undernutrition. So I think school food environments the first, of course, home food environments as well. I really think a neat S tool is required for homes as well to assess, so that mothers can quickly assess what their or parents can quickly assess. I don't want to say mothers. It's an equal role for parents, for both the parents as well. So at household level, is there a tool for me to assess how healthy my household food environment is? I think our next step should be that, a very, very important for us. And the second most important takeaway for me is from our friend from media, Miss Anona. She said, we as nutrition advocates now have an important role to move into spaces where information is consumed by adolescents, and those are digital spaces, and then digital platforms where, as of now, short video formats do very well. There could be newer formats in future with all the new advancements that we have got, but I think storytelling is one thing that is very appealing. That's what the current thing says. And then now, uh, like many influencers are on digital platforms saying what they want to say, we need to create more positive influences from our side who can enter these digital platforms where the information is being consumed by adolescents. And the third key takeaway for me is there is a need for neatest tools. I mean, from what sorry not neatest, but uh, tools to assess nutrition and food literacy, like what Simran has done or what Neha has done in terms of qualitative research. But there should be more tools that can assess the knowledge domain, the skill domain, and the practice domain, and be useful for corrective measures both at individual level as well as at a family or a school level. Fourth key takeaway for me is tools like NEATES are very, very important to assess the school food environments where children spend most of their time. And then these tools can help in terms of understanding what is deficient at an individual level, but also at a school level and at a policy level. If they can be integrated into policy like Sri Lanka has done, it would be very, very useful. I think we in India are a little far from that. We are initially trying to assess the school food environments in different contexts. But one example that Dr. Naini has said is that engage with policymakers, with everyone who matters to change the school environment right at the beginning, so that what you say can be taken forward by them. So it is not them and us now, it is us altogether. So that's very important takeaway. The fifth and most important takeaway that I take from Anupriya is skill building, how it is important, the role of parents. And again, I come back to the importance of skill based nutrition education, wherein the skills are very, very important to help students differentiate between healthy and unhealthy foods, ability to read the nutrition information on labels and then make a judgment, and final, the most important is the ability to choose from what is locally available and not be carried away with what is marketed and advertised to you. So these are my five key takeaways. Thank you very much to the esteemed panel and great speakers who have joined from different parts of the world. Spending 2.5 hours on a day is a very, very, I mean, not even 2.5 hours, it's almost 3 hours. Thank you very much. Thank you all. And then I'm very happy that a lot of our participants have been there with us. And now, in the last 10 minutes, I see dwindling of numbers. No wonder it's lunch hour in India. So most of them would have logged out for that, but YouTube still continues its sway. There are quite many people still joined us on YouTube. Thank you very much. We will make a quick outline of what we've discussed today as a policy brief, and then come up with, and if possible, share with some of you. Thank you very much for joining. I'll thank our director, Dr. Bharti Kulkarni, for all her support, and also my colleagues, Manika Sharma and Pritu Mishra, Sanjay Pandey, and all others who have been there, and also Dr. Tina and Monica Arora from PHFI, and also all our consortium members for all their support all through. Thank you very much, and thank you to all the media friends who've joined. If you've joined, please give wide publicity to it, because media advocacy works with the program makers and policy makers. Thank you very much. Thank you all. Have a nice day. Please endeavor to fix our food. So let's fix our food. Thank you.